Welcome to Cam in Medicine. Please remember that the topics covered on this channel are for educational purposes and should not replace professional health care. In today's video, we will be discussing carpal tunnel syndrome and the causes. Then later on in the video, we will share exercises including Senaman, a traditional form of physical training used to strengthen the body that can help provide relief from its symptoms. Did you know that millions of people around the world suffer from carpal tunnel syndrome? This condition, once associated primarily with factory workers and typists, is now increasingly common in our digital age. The widespread use of computers, smartphones, and video games has led to a surge in cases of carpal tunnel syndrome. The repetitive hand movements and awkward postures often adopted while using these devices put excessive strain on the wrists, increasing the risk of developing this painful and debilitating condition. The good news is that carpal tunnel syndrome is treatable, and simple exercises or Senaman can provide significant relief. By understanding the condition and incorporating these exercises into your daily routine, you can take control of your wrist health and prevent further pain and discomfort. Remember, it's crucial to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan. Carpal tunnel syndrome occurs when the median nerve, which runs from your forearm into your hand, gets compressed at the wrist. The carpal tunnel is a narrow passageway in the wrist formed by bones and ligaments. The median nerve travels through this tunnel along with tendons that control finger movement. When the tendons in the carpal tunnel become irritated or inflamed, they can press on the median nerve, leading to the symptoms of carpal tunnel syndrome. Symptoms of carpal tunnel syndrome often start gradually and may worsen over time. Common symptoms include numbness or tingling in the thumb, index, middle, and part of the ring finger, pain in the hand and wrist, which may radiate up the arm, weakness in the hand, making it difficult to grip objects, a feeling of swelling in the hand and fingers, even if there's no visible swelling. Symptoms are often worse at night or after prolonged hand use. Coming up, we will discuss the exercises that can relieve the symptoms, but first we would love to hear from you. Comment below where in the world you are watching from. Also, let us know if you have any issue with carpal tunnel syndrome, and consider giving more information about your lifestyle. What do you suspect may be causing your symptoms? Do you use gadgets a lot, type a lot, play video games? Comment whatever you think may be causing it. Now let's continue. Exercises for carpal tunnel syndrome aim to stretch and strengthen the muscles and tendons in the wrist and forearm, reducing pressure on the median nerve. Improve flexibility and range of motion in the wrist, allowing for smoother hand movements. Enhance blood flow to the area, promoting healing and reducing inflammation. Remember to perform these exercises gently and gradually, increase the intensity and duration as your symptoms improve. Consistency is key, so aim to do these exercises regularly for optimal results. If you experience any pain or discomfort during the exercises, stop immediately and consult with a healthcare professional. The wrist flexor stretch targets the muscles on the palm side of your forearm, which can become tight and contribute to carpal tunnel syndrome. To perform the wrist flexor stretch, extend your arm in front of you with your palm facing up. Keep your elbow straight and gently bend your wrist, pointing your fingers towards the floor. You should feel a gentle stretch in your forearm and wrist. Hold the stretch for 15 to 30 seconds, then release. Repeat the stretch 2 to 3 times on each hand. This stretch helps to lengthen the wrist flexor muscles, reducing pressure on the median nerve and alleviating pain and tingling in the hand. It's a simple yet effective exercise that you can do anytime, anywhere to find relief from carpal tunnel symptoms. Median nerve glide, freeing the trapped nerve. The median nerve glide is a specialized exercise designed to improve the mobility of the median nerve within the carpal tunnel. This exercise is particularly beneficial for individuals suffering from carpal tunnel syndrome, a condition that can cause significant discomfort and impair daily activities. This exercise helps to floss the nerve, reducing friction and irritation. By performing this glide, you can help to alleviate the symptoms associated with nerve entrapment. To perform the median nerve glide, 1. Extend your affected arm forward with your palm facing down. Ensure your arm is straight and your shoulder is relaxed. 2. Make a gentle fist with your hand. Be careful not to clench too tightly. 3. Keeping your fist, slowly bend your wrist upward as if you were trying to touch your forearm with your fingertips. This movement should be slow and controlled. 4. As you bend your wrist, extend your fingers straight out. This will help to stretch the nerve further. 5. Hold this position for a few seconds, then slowly lower your hand back to the starting position. Make sure to move gently to avoid any sudden jerks. 6. Repeat the exercise 5 to 10 times on each hand. Consistency is key to seeing improvement. You may feel a gentle tingling or stretching sensation in your hand and wrist as you perform this exercise. This sensation is a sign that the nerve is being mobilized. This is normal and indicates that the nerve is being mobilized. If you experience any sharp pain, stop the exercise and consult with a healthcare professional. The median nerve glide can help to reduce numbness, tingling, and pain associated with carpal tunnel syndrome by improving nerve gliding and reducing nerve entrapment. Regular practice of this exercise can lead to significant relief and improved hand function over time. Tendon glides. Enhancing flexibility and reducing pressure. Tendon glides are a series of hand and finger movements that help to improve flexibility and reduce pressure on the tendons that pass through the carpal tunnel. These exercises are essential for maintaining hand health, especially for those who use their hands extensively in daily activities or work. These exercises are particularly helpful for people who experience stiffness and pain in their hands and fingers. To perform tendon glides, follow these steps carefully to ensure maximum benefit. 1. Start with your hand relaxed and your fingers straight. This is the initial position to prepare your tendons for movement. 2. Make a hook fist by bending your fingers at the middle knuckle, keeping your fingertips straight. Hold this position for 5 seconds to feel the stretch. 3. Close your hand into a full fist, wrapping your fingers around your thumb. Hold for 5 seconds. This movement helps to engage all the tendons in your hand. 4. Extend your fingers straight out, as if you were reaching for something. Hold for 5 seconds. This extension helps to elongate the tendons. 5. Repeat the sequence 5 to 10 times on each hand. Consistency is key to achieving the best results. Tendon glides help to lubricate the tendons, improve their gliding ability, and reduce friction within the carpal tunnel. This lubrication is crucial for smooth and pain-free hand movements. By keeping the tendons moving smoothly, these exercises can help to prevent stiffness, pain, and inflammation. Regular practice of tendon glides can significantly enhance hand function and overall comfort. Comment below if you have ever done any of the exercises mentioned in this video. Did they help to make you feel better? Also, let us know if you tried any other methods that worked. Don't forget to subscribe to our channel for more health topics. Let's recap. In summary, carpal tunnel syndrome can be a debilitating condition, but with the right exercises and a proactive approach, relief is possible. By incorporating median nerve glides and tendon glides into your daily routine, you can improve nerve and tendon mobility, reduce pain, and regain functionality in your hands. Don't wait for the symptoms to worsen. Start these exercises today. Train your body by using Senaman exercises to ease your symptoms and take control of your hand health. Remember, consistency is key, and with dedication, you can achieve significant improvements. Thank you for watching and take care of your hands. Until next video.